The Glasgow Coma Scale definition. The Glasgow Coma Scale, or GCS, is the summation of score for eye, verbal, and motor response. The score is determined by the sum of the score in each of 3 categories with a maximum score of 15, which indicate a fully awake patient, and a minimum of 3, which indicate deep coma or brain dead state. Purpose: the Glasgow Coma Scale, or GCS, is used to describe the general level of consciousness in patient with traumatic brain injury, or TBI, and to define broad categories of head injury. Procedure number 1. Perform hand hygiene to reduce transfer of microorganisms. Assess eye opening, a maximum possible score of 4 points. Procedure number 2. Initially observe if the patient is opening the eyes spontaneously. Procedure number 3. If the patient is opening their eyes spontaneously, your assessment is complete. Score 4 points. And move on assessing verbal response. Procedure number 4. If the patient does not open their eyes spontaneously, you need to work through following step until response is obtained. You need to move on assessing verbal response. Procedure number 5. If the patient open their eyes in response to the sound of my voice, score 3 points and move on assessing verbal response. So, good evening, sir. Procedure number 6. If the patient does not open their eye in response to the sound, you need to work on assessing eye opening to pain. Example: applying pressure in the nail beds of the finger for 10 seconds. Procedure number 7. If the patient is able to open their eyes in response to the pressure in the nail beds of the finger, score 2 points and move on assessing verbal response. Procedure number 8. If the patient does not open their eyes in response to pain stimulus, score 1 point and move on assessing verbal response. Procedure number 9. If the patient does not open their eyes for some reasons like oedema, trauma, dressing, they should document as not testable or NT and move on assessing verbal response. The rationale to evaluate patient wakefulness and awareness in the surrounding. Assess verbal response. A possible maximum score of 5 points. Procedure number 10. Initially, try to engage the patient in communication and assess if they are oriented. Some common question you can ask to help assess. This might include: can you tell me your name? Do you know where you are at this moment? And do you know what the date is today? Procedure number 11. If the patient is able to answer your question appropriately, your assessment and verbal response is complete. Score 5 points and move on assessing motor response. Good evening, sir. Can you tell me your name?
Paul Ardoyo
Do you know where are you at this moment?
at hospital.
Procedure number 12. If the patient is able to reply but the response don't seem quite right, like they don't know where they are at the moment or what the date is today, this is classified as confused conversation. Score 4 points and move on assessing motor response. Good evening, sir. Can you tell me your name?
James.
Do you know where you at today?
No.
Procedure number 14. If the patient is making sound rather than speaking word, this is classified as incomprehensible sound. Score 3 points. And move on assessing motor response. So, good evening, sir. Can you tell me your name? Do you know where you are at this moment? Do you know what date is today? Procedure number 15. If the patient does not answer your question, score 1 point and move on assessing motor response. Procedure number 16. If the patient is intubated or with tracheostomy or other factor interfering their ability to communicate verbally, the response could not be tested. And with this, you can write NT or not testable. And move on assessing motor response. Rationale, to evaluate patient wakefulness and awareness. Assess motor response. A possible maximum score of 6 points. Procedure number 17. Ask the patient to perform 2-part requests, like, can you lift your right arm and make a face, sir? If the patient is able to follow your command, score 6 points and the assessment would be over. Procedure number 18. If the patient does not follow your command, apply painful stimuli. If the patient makes attempt to reach the site at which you are applying the painful stimulus, like in the head or neck, and brings their arms above their clavicle, this is classified as localizing to pain. Score 4 points and move on, and the assessment would be over. Procedure number 19. If you apply painful stimuli and the patient withdraws to the pain, like if the patient tries to pull their arms away from you at which you are applying painful stimulus in their fingertips, score 4 points and the assessment would be over. Procedure number 20. If you apply painful stimuli and the patient responds with abnormal flexion, score 3 points and the assessment would be over. Procedure number 21. If you applied painful stimuli and the patient responds with abnormal extension, score 2 points and the assessment would be over. Procedure number 22. If the patient does not follow your command, score 1 point and the assessment would be over. Procedure number 23. If the patient is unable to provide any motor response like paralysis, this should documented as NT or not testable. Procedure number 24. Once you assess the eye opening, verbal response, and motor response, add the score and calculate the patient's GCS. Rationale. Evaluate patient ability to obey a command, localize, withdraw, or assume abnormal body position in response to a painful stimulus. And procedure number 25. The GCS should be documented showing the score for each individual behavior tested. The rationale for procedure number 24 and 25, documentation contribution to continue data collection necessary for the client's care plan. And the Glasgow Coma Scale is already done.